Hello, we're going to look at some general points about anatomy, which are essential for understanding any anatomy course. First of all, we're going to talk about anatomical terminology. In fact, the nomenclature has had to change recently, as there has been a problem of standardization of anatomical terms throughout the world. An international agreement was therefore drawn up for the universal study of the human body, leading to the development of an international anatomical nomenclature. This is the Latin nomenclature, known as the Nomina Anatomica or the New Nomenclature. This means that certain French terms used in the past, such as the cubital nerve, are no longer relevant. We no longer speak of the cubital nerve, but of the ulnar nerve, so the term cubital has been replaced by ulnar. The same goes for the calf bone, the bone in the leg that we used to call the calf bone, and now we use the word fibula instead. And this nomenclature is used internationally, so it's easy to communicate with any doctor, whatever their nationality. So what is used and what you need to remember is the new nomenclature in order to learn the terms that are currently used internationally. Diapo 4. The second very important point is to know what the anatomical reference position is. You know that to position one organ in relation to another, well, that depends on the position adopted by the body, and so it will change depending on that position. It was therefore necessary to choose a reference anatomical position which we will always use in all the chapters and which you will find used in all the anatomy books. This position is as follows. Well, the body should always be studied standing with the upper limbs hanging down along the upper body, of course, with the palm of the hand here facing forward and the thrusts outwards, looking towards infinity and feet together. And so it's always in relation to this position that we'll position one organ in relation to the other, not lying on your back or sitting down. It's always the same position as we've just explained. So, what's also important for the study of anatomy is orientation in space. But you already know that in space, there are three axes: the vertical axis, the sagittal axis, and the transverse axis. In space too, there are three planes: a horizontal plane, also called axial in radiological language, a frontal plane, and a sagittal plane. So, in relation to these three planes, we position the various organs one in relation to the other, making cross-sections of the body in one direction or the other, enabling us to study anatomy and relationships of the various organs. To sum up, a body can be divided into different planes. We speak of a sagittal section when we cut the body along a sagittal plane. We'll also speak of a frontal section when we cut the body along a frontal plane, and we'll speak of a transverse, horizontal or axial section when we use transverse or horizontal planes to cut the body. So, for the sagittal planes, here we have a sagittal plane passing through the body. Sagittal planes can be defined as planes oriented in an antero-posterior direction, so you can understand that there are several sagittal planes passing through the body, can't you? Among these planes, the strictly median one passes through the axis of the body. It divides the body into two equal halves, right and left. Parallel to this median sagittal plane, there are paramedian sagittal planes which will also cut the body into two parts, right and left, but which will of course not be equal. Now for the frontal planes. Here we have a frontal plane that cuts the body into two parts, forwards and backwards. So, a frontal plane can be defined as the plane that cuts the body into a ventral part, forwards, and a dorsal part, backwards. The one that is strictly median is called the coronal plane, which means that the coronal plane is a frontal plane that passes through the median line and cuts the body into two equal halves, ventral and dorsal. The horizontal planes are, as we explained earlier, planes that can also be called transverse or axial planes. They are, of course, perpendicular to the other two and cut across the body. It's as if we were slicing the body into several strips, isn't it? In other words, horizontally. A horizontal plane, which is represented here on the slide, will therefore separate two parts of the body. What is located above will be said to be in the cranial position, towards the skull, and what is located below will be said to be in the caudal position, caudal being an adjective relating to tail, downwards. For example, here you have CT scans, which are horizontal or axial slices, showing a vertebra with the soft tissues around it, an axial slice. So, it's widely used in CT scans. Now for the frontal planes. The frontal plane is shown here on the slide. It separates two spaces or two zones. What lies to the front is referred to as ventral or anterior, and what lies to the rear is referred to as dorsal or posterior. The sagittal plane also divides the body into two parts. Anything approaching the median sagittal plane will be said to be medial, or in a medial position, and anything moving away from the median sagittal plane will be said to be outside or in a lateral position. So, if we want to position one organ in relation to another, the one that is closer to the sagittal plane will be said to be medial in relation to the other organ, and conversely, the organ that is far from the sagittal plane in relation to the other will be said to be in a lateral position in relation to the first organ. Here, for example, is a sagittal section through the spine, showing the various vertebrae one on top of the other. So, these are parasagittal slices again on the scanner. This scanned image can, therefore, be used to distinguish anterior from posterior or dorsal positions. We've already explained some of these terms, but we'll come back to them. What does medial mean? The word medial refers to everything close to the median sagittal plane, and the word lateral refers to everything far from the median sagittal plane. We've explained this in previous slides. And now there's also the term superior or cranial or cephalic, which are synonyms and mean the same thing, close to the superior extremity, and of course inferior or caudal, which are synonyms and mean something close to the inferior extremity. There's also the word proximal and distal. These two terms proximal and distal are used when talking about limbs, so anything proximal means close to the point of attachment of the limb. For example, here you have the upper limb, and here is the point of attachment of the limb, where the upper limb attaches to the trunk, and here you have the lower limb, of course, and here is its point of attachment, where the lower limb attaches to the trunk. Any element is said to be proximal if it's close to this point, and distal if it's far from it. For example, if I want to position the elbow in relation to the hand, I can say that the elbow is proximal in relation to the hand. It is closer to the point of attachment of the limb than the hand. And the hand is distal to the elbow that is closer and the hand rather further away, situated further from the point of attachment of the upper limb than the elbow. The foot, for example, it's distal to the knee, all right, and the knee is proximal to the foot. There are other terms used in anatomical language, too, homolateral and contralateral. Homolateral means on the same side, an element and another that are both located on the right side. We can say that they are two homolateral elements, and conversely if we have an element or a structure located on the right and another located on the left, we'll say that these two structures are contralateral, or structure is contralateral to structure B if the two occupy different right and left sides. So, among the other terms to explain, there's the anterior or ventral term relating to the belly, located in front close to the anterior wall, so at this level, everything that's anterior is in front, its opposite is posterior or dorsal, relating to the back, located close to the posterior wall. There are also two terms, one of which is the opposite of the other, internal and external. In the old nomenclature, the terms internal and external were used to designate respectively what was medial and lateral, and now these terms are used to describe a hollow organ, an organ that is empty on the inside, such as the intestine, the stomach, the heart. So, when we speak of the internal description or internal configuration of an organ like the stomach, we mean the description of how it looks from the inside. On the other hand, the term external means the outside of the hollow organ, and so to speak of the external aspect or external configuration of the stomach is to describe the stomach as seen from the outside. So internal means the inside of a hollow organ and external means the outside of a hollow organ. For those who haven't understood the word viscera, it simply means organ. So, we're talking about viscera or organs, it's all the same. There's also the term superficial and the term deep, which are two terms that are the opposite of each other. And what does superficial mean? Superficial means the most peripheral layer, the layer facing outwards, whereas deep is the opposite, the layer facing inwards. Take the forearm, for example. The most superficial layer you see on the outside is the skin, so the skin is the superficial layer. We can therefore use these terms to describe a bone, or rather to position the different parts of a bone. Here we have the femur, thigh bone. It can be said to have an upper or cranial or proximal end, and a lower or distal or caudal end. It also has an inward-facing edge that's closer to the axis of the body, and so this edge, which is closer to the axis of the body, would be called medial. On the other hand, this edge, which is further from the body axis, is called lateral. And now we come to the structural organization of the human body. The smallest element that makes up the body is the cell. The cell is the basic structural and functional unit that makes up a tissue or organ. Each cell is given a name according to the tissue it constitutes. For example, neurons or blood cells or muscle cells or bone cells. A group of cells forms a tissue. So, what is a tissue? It's a set of cells, and there are several types of tissue in the body. There's bone tissue, for example, which of course makes up the bone, muscle tissue which makes up the muscle, and so on. And then a set of tissues of different natures will form an organ. Here, for example, is the liver. Well, it's made up of several types of tissue, including, of course, what we call hepatocytes, which are the liver cells that form the liver tissue. We call it liver tissue, but there's also connective tissue, and so there's a set of tissues that will form an organ. So, we have the cell, the body's structural unit. A set of cells forms a tissue and a set of tissues forms an organ. Now we need to define two entities, a system and an apparatus. What is a system? It's a set of organs made up of the same tissues. We'll talk about the skeletal system and the central nervous system, for example. It's a set of organs but made from the same cells and tissues. So a system is a set of organs whose common feature is the tissue from which they are made. What, on the other hand, is an apparatus? An apparatus is also a set of organs, but they don't have the tissue they're made from in common, but rather their role. For example, the digestive system is made up of the intestine, the stomach, the liver, etc. All these organs work in synergy to ensure digestion. There's also a urinary system made up of kidneys, ureter, urethra and bladder. It's a set of organs whose role is to filter the blood and evacuate urine. And so on. That's the